Hello, I'm Dr Jeyarajah. I'm a liver, biliary, and complex GI surgeon here in the Richardson area of the Dallas-Fort Worth area. A little bit about myself. We have a practice in the Richardson area at Methodist Richardson Medical Center where we primarily focuses on diseases that are really complex in the GI system. And that would be things like esophageal disease, stomach problems including cancers, liver and bile duct tumors and diseases of the liver and pancreas. I also do some colorectal work, especially when there are malignancies that are spread to the liver. Our first interview today is going to be with a patient of mine, Mr. Cannon, who is a long-time survivor now of esophageal cancer. He's going to share with you his story and how surgery played a role in his recovery and his great quality of life now. Well, thank you all for joining us today. It's my great pleasure to spend some time with one of my patients, Mr. Cannon. Mr. Cannon, thank you so much for joining us today. Really, the purpose of today is to try to help patients with similar diseases to you to really understand your journey and really help them get through the process of dealing with the diagnosis that can at first blush look devastating. So Mr. Cannon, tell us a little bit about how you felt that led you to go to the doctor in the first place.
I had trouble swallowing, and my son had the same problem years ago, and he recommended a doctor over at Presbyterian, so I went to see him. He did an upper GI and endoscopy and called me 10 days later and said, "You have cancer of the esophagus." And I was stunned. I really was. My wife was beside herself. And he wanted to do another endoscopy and did another endoscopy, but he was not there. He sent another doctor to do it. And then we didn't hear anything. He was in quarantine. He had gone on a cruise, and we didn't hear anything. Well, my daughter is a friend of Dr. Michael Truitt. Their daughters played softball together, and she was keeping Dr. Truitt, unbeknownst to me, advised about what was going on. And he said, "Let me give you this doctor's name. I want you to get your father to call him." And he said, "I'll tell you what, I'll call him myself." And so he called Dr. J's office, and that's how it started, and they called me immediately, and I was in the next day. We had all the tests done that week. I remember laying in bed at night and thinking about what's going to happen. How will I respond to all this? I prayed to God that I would have my family around me, it would be successful, and that all the worry and all the trauma, the constant worrying, hoping that this would go smoothly and that I would be fortunate enough to survive this.
Yeah.
And fortunately, everything worked out wonderfully. I had absolutely no pain. I think I've mentioned that to you several times. I remember my wife telling me in the hospital room, "Just press the button." And I said, "Well, why am I pressing the button? There's no pain." This journey is worrisome at first, but now I look back, I had no reason to worry at all. And I'm just so fortunate to have Dr. J and his team to guide me through this whole process. I praise God and thank God every day for leading me to Dr. J.
Our next patient is Mr. Steve Walcott. He's really an amazing miracle of how one can survive several cancers, and he'll tell you a little bit about the syndrome that he has called the Lynch syndrome, which is an unusual syndrome that causes cancers of many parts of the GI tract. I specifically was involved in treating his cancer of the duodenum that required a complicated procedure called the Whipple procedure. I like to think about this as the Woodall Rogers of the abdomen. So I say 75, 45, and 35 all come together right here, and we've got to take pieces of each of those to reconstruct the patient after taking out the front part of the pancreas, the duodenum, and the end part of the bile duct. This is really a very complicated procedure, and thankfully Steve will tell you about the recovery from that, from his personal perspective. Hello everyone, thank you for joining us today for our interview with Mr. Walcott, who is one of my patients. Mr. Walcott brings a tremendous perspective today because unfortunately he was diagnosed with several different kinds of cancer, one of which needed my help from an operative standpoint, but is doing great and is tumor-free at this point and is truly a miracle and a testimony to us all. Mr. Walcott has become a dear friend over the many years, and I'm so thrilled to introduce him today. Mr. Walcott, thank you so much for joining us.
Thank you.
And thanks for agreeing to do this. This is really beyond what we could ask, and we're just honored to have you.
It's an honor for me.
So walk us through a little bit, Mr. Walcott. As I recall, your first cancer diagnosis was a colon cancer, is that right?
That is correct. I was 36 at the time. This was 1987. I had a colectomy surgery.
Yes.
Which, it solved the problem at the time. No treatment, by the way.
Yes.
And I was, at the time, clinically diagnosed with Lynch syndrome, which is a genetics malfunction, if you will.
Right, so that is a genetic-based driven cancer-forming syndrome, correct?
That's correct.
And so that was great that your doctors picked that up at that point.
Oh, it was terrific. I was later tested for sure, and it was confirmed that I had it. Briefly, my little sister had colon cancer at the ripe old age of 23.
Wow.
She preceded me by about 6 months. So she has been tested, and she also has Lynch syndrome. I have two brothers in between who are negative, thankfully.
So they managed to skip that gene.
They skipped that gene.
Right.
They've been just fine. Well, when I was diagnosed, we knew what I was facing. I was feeling pretty positive because the oncologist told me that it was operable, but it was a very complicated surgery. And I still have, by the way, the small piece of paper, the little memo, and he wrote down, he said there were a limited number of surgeons in this area that could do this. And
we're talking about the Whipple
procedure. We're talking about the Whipple. He wrote down 4 names, and being the persistent guy that I am, I twisted his arm and asked him to circle one of the names, and he circled yours.
It's great to meet Vicki Pinney today. She's really an amazingly vibrant human being who came to me with the diagnosis of pancreatic cancer. Like one of our other patients, Vicki needed the Whipple procedure, which is this really complicated procedure that's really 3 operations in one. It's a stomach procedure, a pancreatic procedure, and a bile duct procedure. It's one of these surgeries where actually the number of cases that you do is important. So as you look at the surgeon that's going to be operating on you, you do want to find out how many the surgeon does and how many are done at the institution where you're having that operation. I would really take the time to research this, and we're here to help you in any way. Hello everyone, and thank you for joining us for our next interview. This is with an amazing patient of mine, Ms. Vicki Pinney. Vicki was diagnosed with pancreatic cancer and had to undergo the Whipple procedure and is doing great. So we're so honored to have you today, Vicki. Thank you for being here with us.
Thank you for asking me.
Well,
I feel so honored to be here.
You're tremendous, and we are so, from the minute I met you, I felt that there was this amazing spirit within you that has such a joy for life.
Thank you, I do.
Tell us about how you were diagnosed, Vicki, and how you knew that something was wrong.
Well, I It was during, it was August 2020, during the COVID's first wave. And I was basically sheltering in place with my spouse at the house. And I kept getting these horrible pains very deep underneath my sternum that wrapped around to my back that left me curled up in a ball. I mean, it was painful. And after about 2 times of this, I went to the doctor. One thing led to another. They did the MRI, and there it was. Tumor on the head of my pancreas.
After the Whipple procedure for pancreatic cancer, it's pretty common that we need to give what we call adjuvant chemotherapy, which is chemotherapy after the operation. Now, Vicky actually made the decision that she did not want that. And I kind of want you to talk through that for us, Vicky, because I do think, as you know from our team, we want to support what you want. It's not a decision, nothing that you decide is ever wrong, because it's right for you.
Right.
So tell me about that process.
Well, as you know, I went so far as you went ahead and put a port in. I have a port in now. I was ready to go, you betcha. You sent me to a wonderful oncologist. She listened to me, asked, I had a ton of questions, and she answered them all. She was kind. And something kept gnawing at me. Something did not feel right. And I kept wrestling with it, wrestling with it, wrestling with it. And I was set up to start chemo on Monday. And I was pacing the floors. It was just almost more than something just did not feel right.
And you would say that this felt even more different than undergoing the Whipple?
Yes. Yes. Oh, yes.
Which is interesting, right? Because people always think surgery probably is the biggest deal.
Oh, no.
But I understand what you're saying, because chemo is something that's kind of more ongoing, right?
Yeah.
As opposed to one thing.
And I kept saying to myself, well, you know, it was nowhere else in my body, and they got clean edges. Nowhere else in my body, and they got clean edges. And that kept like a recorder going in my head. Finally, one night I laid in bed and I said, okay, I need to pray on this. I need to turn it over to you, God. I need to know what to do. I don't know what to do. Something is not right. Something does not feel right. And it dawned on me, you know, I said, you don't want the chemotherapy, because you have always been about quality, not quantity.
Yeah.
Once I made the decision, it's like, I'm not kidding, it's like this peace came over me.
I call that the peace that passes all understanding.
It just was like a wave.
Yeah.
And I settled, and I didn't pace anymore. And I walked in there to my spouse, and I woke him up, and I busted out crying. And I said, I do not want the chemo. And they were behind me 100%, my family, whatever I wanted.
Did you feel that the team here was behind you?
I did. After I explained, I came in and I explained, and you know that, you know, I just felt, you know, for me, you know, I kept going clean edges, nowhere else in my body. I know it was preventative, but I was still about quality, not quantity.
Right. Vicky has really demonstrated to us how it's important that we support the patient's choice. We're here to give you the information. It's your decision as to what you want to do with that, and we support you 100%. The team is really important. Please spend the time to choose your team. We would love to be part of that team, but really we're here to support you and give you information. If that's somewhere else, that's fine. We want you to be comfortable with the decision that you make. Just know there are options out there, and we are here to help you and support you in any way that we can. We hope that this video has really helped you get an idea that life is possible after a cancer diagnosis.